Hello everyone, dear friends. I'm glad to see you back on our channel. Today we have a patient with us. Her name is Alina. I almost said came instead of was admitted. The phrase is right on the tip of my tongue. That's a medical term, so if I say it, please don't judge me too harshly. Alina, please tell our viewers yourself what brought you here and what complaints you have.
Mainly, I have discomfort in my lower back. It gets difficult when I stand or walk for a long time. Also, my cervical spine, the seventh vertebra, and I also have occasional pain in my feet. I've also had concussions, and I think maybe that could have had some effect as well. Well, that's everything that came to mind for now. I've listed it all.
All right. A question about injuries. What kind of injury did you have? What was its nature? Have you had any injuries?
Yes, not long ago I had a knee injury.
How much time has passed?
Almost 8 months.
8 months. So it hasn't even been a year yet? Yes. So you could say you should still be in the rehabilitation stage?
Yes, that's true. That's right.
I guess you're swimming now. Are you doing any physical therapy?
Yes, I'm doing exercises.
So will you show us the exercise?
Well, I can, yes.
All right. Okay, so was it a cruciate ligament tear? Yes.
The cruciate ligament tear and damage to the posterior meniscus, or the medial meniscus.
Right. The meniscus, did they cut it out?
No, they stitched it.
And the cruciate, what did they do with the ligament?
They replaced it with a graft.
Your own?
Yes.
Got it. How is your knee behaving now? Do you feel any pain when you go down the stairs or when you go up? If you do feel pain, when does it happen? Going up and down or only in certain situations? Both.
Up and down, but only in specific spots. So it's not constant anymore. But we,
aren't counting the moment when you... By the way, how did you tear it?
during training.
Tell everyone what kind of training.
At the fitness center during a group workout session, my knee just suddenly twisted out of nowhere. I unexpectedly lost my balance and fell over to the left side.
Fitness is like that. It's better than hanging around the corner using, I don't know, some kind of vapes. But when it becomes truly fanatical, all sorts of unexpected things can happen. So, dear trainers, if any of you are watching me right now, I have a very important request. Please, I kindly ask you, do not overload people. Don't take things to fanaticism. I know that many people watch me, I mean trainers, fitness instructors, and even doctors, knee specialists. So I'm asking this as well, even though I did sports myself, but there too, everything was taken to extremes. Now there's an injury and you just have to live with it and keep going. I'm not the only one. Most people are like this. There are young children who come in who do gymnastics. Gymnastics, to be honest, is one of those sports that probably in arthrology, and in general, anyone who works with the musculoskeletal system, I think it's one of those areas that is often disliked or neglected. When a person is growing, yes, developing as a child, that's exactly when they're pushing it to the limit. And in gymnastics, there's no other way. At least that's how I understand it, though honestly, I'm pretty far from gymnastics myself. The most I have here is flexible fingers. That's the extent of my gymnastics. But I do understand that later on, when elasticity is, so to speak, not the same anymore, and usually I guess that's around age 17, after that things become a bit different, not as pronounced. It doesn't show itself the way it does at, say, 6 or 7 years old. So how did you tear your ligament?
It just happened out of nowhere.
Like I did?
No, I was moving my leg to the side and my knee twisted. I fell, but even after that I tried to keep practicing. Then I flew to another city and there it bent backwards again. That's when I thought something was wrong.
The main thing is not to think I'm going in the wrong direction.
Yeah, I went and got an MRI. Based on the scan, they told me I needed surgery. Otherwise, my joint would wear out quickly and I'd have to replace it. I don't even know if I did the right thing.
No, you did the right thing, especially if you didn't have stability, if it kept popping out.
Yeah, it kept popping out.
I'm not really a fan of artificial ligaments when they put in an implant, but when it's your own, so to speak, why not? It's alive, it's being nourished just like before. The only thing is, you have to work on it, you have to strengthen it. So, for now, it's for life. If someone can live without it, that's not your case. As I understand it, you took a step in some direction, and at that moment there was a sound.
There was no sound.
It even happened without a sound.
Well, there was music playing, I heard that.
I wasn't so lucky. When I played football, I heard my own sound very clearly. That's why I realized it right away. Alright, anything else? Have you had any other surgeries?
Well, maybe, I think, there was something from plastic surgery.
Maybe. Alright. Okay, we understand everything. Regarding the lumbar region, discomfort occurs closer to the evening, at lunchtime, when you stand for a long time, or when you walk for a long time.
When you stand for a long time, but probably also when you walk for a long time.
Alright, this just got even more interesting. Okay, we'll let you change now, as we said. Next, we'll move on to our examination, Aladdin. We'll take a look at you and assess your condition. So with any kind of load, it's your spine that is affected. While standing, when your muscles are tense, we'll examine you and assess. We'll check for any misalignment. Laser assistance. Usually it's a laser. Yes, it's used in construction as well. Listen, don't judge me too harshly about the laser. Let's be honest here. The screwdrivers used in traumatology, in some regions they're still just regular ones. I won't even mention the brand, it's just an ordinary screwdriver. When I was on duty at KBSP, they brought in a guy, well, a man. I don't remember what kind of injury he had. I think it was something with his hip. Anyway, they were suspending a weight for him. And they needed to drill a pin between the Achilles and the bone and hang the weight. Just a regular screwdriver. No, I had the same kind of screwdriver at home. And even now, in all medical centers, it's the same. The only difference is the casing. Everything else is the same. Here, I don't know. If you take our laser, well, maybe it has a medical license. We use it just to observe from the side, that's all. There's nothing more straightforward today, except for the laser. Alright, go ahead and change. And then we'll move on to the examination. After that, on the examination table, we'll palpate and assess. And then we'll proceed directly to the therapy itself. So stay tuned. Dear viewers, according to YouTube's platform rules, we cannot upload the following videos. You can follow the link to Boosty. There, it's available by subscription. You can watch our examination in more detail there, and a more complete video. So, dear viewers, let's move on to the examination. Our patient is lying down. Axial unloading. The patient has relaxed. Relaxed? Relaxed. Visually, we can see. I hope you can see it too. On your screens that the left side of the lumbar region, it is in a state of hypertonus. But at the same time, the right side is considered overloaded. Apparently, the load comes from the deviation. In this case, we need to strengthen the left side. But if we're talking about asymmetry, but we always start with symmetrical loads first. That's if we're talking about slightly correcting the arc's deviation. Here it's the exact opposite. That is, we need to strengthen it. In other words, in the future when we work with the patient, we can move on to asymmetry. Again, only after conducting an examination, of course. If the wheel-like deformity is confirmed, and we need to correct it a bit, so to speak, using the muscles, then we can do something like that a little later. Excellent. Alright, then everything is clear here. Here we have hypertonicity. The muscles are overloaded. The scapula. Relax. Are you relaxed? Is it there? What hurts?
I'm just doing these as point movements. I press sharply.
Got it. The rhomboid muscles, they need strengthening. It's easier here. What am I witnessing here? And there's nothing like that here. This right here, just with the finger, and it contracts immediately. There's nothing like that here. All right? Okay, then we'll move on to the massage. Let's get ready now. And the monotherapy itself.
Just please be gentler.
It's already too late. So, dear viewers, we finished the massage. Was it good? Did you like it?
Yes.
Next, our tasks with you. Stretch, pull out, and create mobility. Joint. Even like this, I walk according to the width. It goes away a little. Thoracic region. Flex. Your task is to relax. You can... Let's start with the thoracic region. In this way, we stretch the lumbar region.
This is actually tough.
Motivational. Relax.
Wash away the records, right?
Yes. Relax. More. So, dental implants, when they were originally installed, just relax.
Oh God, better.
You're tensing up. I can do it too. Come on, relax. Let's
You make it look nice. So it records beautifully. No, let's...
do it the way we do it. Okay?
This is very scary.
Well, everyone goes through this here. And
Is it the same everyone?
no. There's nothing scary if you end up screaming a little over there. Let's go. Inhale, exhale. More. Okay, let's just move on.
A bit.
Differently. Now, onto your side. And then we'll...
And on.
your back.
On at this moment.
Your right side. Hand under your head.
Like this?
Yes, closer to me. Relaxed. More. Other side. That's fine. Closer to me, right here. Turn your torso. Head this way too. Now lie on your back. Careful. Put your right hand on your left shoulder and your left on your right. Relax. More. Relax. As soon as I touch you, you tense up right away. Come on, relax. More, relax. Well, nothing hurts.
No, not now.
Let go. Turn onto your left side and sit facing me. Upper thoracic spine. We interlock our hands behind the head.
Is this like in Thai massage?
I don't know how it's done in Thai massage. Move the hair clip a bit to the side. Take off the hair clip. That's it. Yes, hands interlocked behind the head.
It's often scary, isn't it?
I'm fine with it.
No.
Cabbage roll for now.
Please, the lower one.
Like this. A bit more. So what, really?
Well, you know.
What? Is it hard?
Well, you know.
Then let's move on to the cervical spine. Tilt your head. Relax. That's normal. We'll just go over this area a little now. Lie on your stomach. We won't torture you much. Let's go a bit lower. Rest your chin on the mat, arms along your sides.
On your...
Chin, arms along your sides. Side stretch. Good. Don't help, just relax. Lie comfortably on your back.
Let's do decompression, which means we will extract and restore the original files from the compressed archive.
Now,
To know...
really surprise our patient. All right, we're ready for decompression. Total relaxation. Whoever makes up their mind will regret it. Did you stretch out?
More.
What do you want?
Keep biting my tongue.
Right now? Other people help with that now. So we've done the decompression. What got stretched? In which areas? What did you feel?
My spine stretched. More at the top, but also in the lower back.
Good. We won't be working with the legs here. The patient refuses. So we'll just let it be. The task is to turn onto your stomach and get up on your forearms. Preferably roll over using the block.
Like this, right?
Yes, elbows together. Good. That's it. Relax.
Okay, sure.
Sit up.
Still facing that way?
Yes, face that way.
That's it. Well...
There you go. You finally got what you wanted after all this time.
Thank you very much.
You're welcome. The patient was very scared. That's why she asked me for certain, so to speak, procedures. So, as they say, the customer is always right. The main thing is, we did everything we needed to on our end. So what now? How are you feeling? What do you notice?
I feel better. I can feel my shoulders opening up more. And overall, basically, it feels like after a good massage.
Good. Let's do a checkup then. Let's see what has changed with your rotation. Come over here. Clasp your hands behind your head and rotate your torso left and right. Keep your pelvis fixed in place. Don't sway. Don't sway. First go as far as you can to one side. Now to the other side. Go ahead. The other side.
Well,
So,
it's fine.
good. So there's no asymmetry like there was at the beginning?
Probably.
All right. So, viewers, let's do a follow-up assessment after the manipulation. We can compare how it was before and how it is now. When the laser blinks, it means I'm holding it crookedly and it can't stabilize. So right now, our right shoulder is higher, but in my opinion, it's become much more even. In other words, they're almost at the same level now. But in the lower section, the asymmetry still noticeably remains and is still present. Well, as for the thoracic area, we're looking straight on. It seems to have gotten a bit better. For side bends, we slide the hand along the outer side of the leg. The outer side of the leg. I'll come over now. Once again, over here. Here it's just a little bit lower. Now let's go down to the other side. Don't lean forward. Let's do it again, yes. Alright, let's correct here. Now it's closer to the truth. So, at this level we've become just a bit lower. Let's do it. Let's measure this carefully and make sure we get it right. Now, I'm lining up with myself, making sure that everything is perfectly aligned and that I am in the exact same position as before, so we can get an accurate measurement and see the results clearly. Good. Turn to face forward. Turn your head. Lightness.
It's easier.
Turn. Good. Well, Lena, that's how your session turned out.
And it was...
Scary, please. Say it like it is.
It was a bit scary, yes.
Well, did it live up to your expectations?
Yes, thank you very much.
Regarding the knee joint, recommendations will also be given to the patient. And as your orthopedist, I will keep reminding you that therapeutic exercise is important. Yes, in this case, by the way, swimming. Swimming in general helps a lot, but you shouldn't think that swimming alone will cure a child's bow legs or anything else. Here, you just need to strengthen and strengthen correctly without pressure. That is, without any load, without axial load. So that's how it is. Thank you for watching. Be sure to subscribe to the channel, like, comment, and share. And there will be more videos coming soon. They'll be just as interesting. Elena, you're all set for today. So have a great day.
To you.
Thank you again for watching. Thank you. Bye.